Now I call Dr. Chaitra Jaydev. She will be speaking on retinopathy, relationship of immune factor level between vitreous aqueous serum and tears, the vast study.
Good afternoon, esteemed judges and my dear friends. Today I'll share some interesting insights into research that we have conducted at Narayanethralaya. We already know that 101 million diabetics are there in our country and 21 million are already at risk for sight-threatening complications of diabetic retinopathy. So there is an imperative need for a definitive treatment with the least number of invasive injections. Vitreous biomarkers have already shown us that they can predict who can get the disease and what is the best possible treatment outcome for these patients. But testing the vitreous is rather risky. It's a small surgical procedure itself. So why not use something like tears or even aqueous, which is available to us when we are injecting these patients? Or better still, why not blood? You know, every other day diabetics check their blood for their blood sugar levels. So that's a feasible option, which is why we came up with this BRIGHT study to look at all 4 samples and compare the different biomarkers that we see in these 4 and see how strongly they correlate in the vitreous aqueous serum and tear study. We employed 22 patients who were undergoing vitrectomy for complications of PDR, and we collected all 4 samples on the same day as the surgery itself. This is in brief on how we conducted the study. In our in-house grow lab, we stored these samples, we segregated them, and we finally analyzed them for soluble factors such as cytokines, chemokines, ICAM, VCAM. So these are all the biomarkers that we looked at, and we looked at 53 biomarkers. We used different quantifiers because one was not able to pick up all of them, and we found the absolute concentration at the end of it. Now what you see here is the plasma had the highest level of protein content, and we used a technique called as normalization to make all 4 of them comparable. What you see here on the right is something called as a principal component analysis, which shows that those biomarkers that came from ocular fluids are grouping together. This gives the component of or the concept of organ specific sampling, which I'll speak about. This is something called as hierarchical clustering. This basically shows that these biomarkers, for example, in cluster 2, you see vasculogenic and immunogenic or inflammatory biomarkers, they are all grouping together. That means they are comparable across these 4 samples that we selected. Now, what our study showed was that close to 80% of samples, that is from the vitreous and aqueous, correlated very well and strongly. Whereas if you look at the tears and the aqueous and the plasma and the vitreous, we saw about 28% across the 4 samples. On the right, you see a very complex Sankey plot. This basically shows a very interesting interplay between the combination of these different samples and the biomarkers that we studied. Now, what we are trying to show here in the red arrows are the clinically significant biomarkers that we found. And what you will see here is, besides the usual suspects of VEGF and angiopoietin 2, we are also seeing a whole lot of other inflammatory biomarkers itself. Yes, we had, some challenges where we had to collect all 4 samples on the same day from the same patient, and especially across different diseases. That was a little difficult. And of course, we must understand that systemic, which issues will have a bearing on these biomarker profile. But testing is repeatable, and I'm sure we'll be able to find good targets and make it even personalized for our patients. This is the first study that showed a strong correlation between vitreous and aqueous with 80%. We also saw a good correlation in tear samples with the spillover that we see. Organ-specific sampling, because of that grouping that we see from ocular fluids, may be a little bit more reliable from other body fluids, but there is definitely a role for surrogate sampling with these minimally or non-invasive samples. Let me show you a quick example. This is a patient with diabetic macular edema, and you can see the response after anti-VEGF. Patient was not very happy. We looked at the aqueous that we had collected at the time of the first injection. You can see that the VEGF levels are very, very low. Intuitively, we switched the patient to steroids, and you can see a fantastic response. Now imagine this other lady. She's come to you. She's very, very scared of injection. She's like, "Doctor, I need just 1 or 2. Please cure me with just that much." Now this is her biomarker profile. When you look at this, you'll say, "Why don't you try steroids?" She might respond, "VEGF again is low." Lo and behold, we did go ahead with steroids, and look at the response. Fantastic. Now imagine the situation that this patient, this biomarker profile, you got even before the first injection, and that too non-invasively, either from her tears or from the blood. Won't it just be fantastic? So friends, the future is bright. We are on the brink of personalized medicine, personalized or bespoke ophthalmology, where there's a non-invasive biomarker that is repeatable and can help not only monitor progression for our patients, but can also predict which is the best treatment for our patient, thereby increasing their compliance to treatment. With that thought, Thank you very much, and I acknowledge my team.
Thank you very much for your nice presentation. Any questions from the judges or audience?
22 patients. We had more, but the sample source was adequate for testing only in 22 of them, because sometimes the tears from the Sherma strip was not adequate.
You are further doing studies to see for more biomarkers?
Yes, sir. In fact, we've already designed a biomarker kit, which is presented in other papers, wherein we are able to do it as point of care. You don't even have to send these samples to the lab anymore. You collect it in the clinic. It's like a dipstick test, which makes it so convenient. Then and there, we are able to already tell whether this patient is going to respond or not. At our institute, we've already done it for dry eyes, and we've got good results. Now the process is on for diabetics as well. If you can just tell them from their blood sample, I think that would be the easiest. But like I mentioned, probably the ocular fluids are going to be a little bit more specific than testing plasma, which has a high concentration of proteins. So with the tear sample or the aqueous, if you can tell them that this is your drug, anti-VEGF or steroid, I think it is going to be not only cost effective, but the patient would also be definitely more compliant.
Thank you.
Thank you.
Thank you very much.
Thank you very much, all the presentator, judges, and all the audience for their invaluable time. Now I request all the presentator and judges for